All right, so we're gonna go right into this. All right. Step one is apply the occlusive dressing. So you're gonna expose the injury. Just move that shit out of the way. Just don't smack the casualty with this rifle. All right. The injury is going to be represented by a piece of tape with a little marking on it. They're reaching to your little bag of goodies. You're gonna pull out the occlusive dressing. Now, because we did revamp everything yesterday and whatnot, so the first candidate that comes through, you're actually going to have to tear it open and everything. But this is, yeah, and remove the gauze if there is one present. All right. Now this is how it's going to be like during test week. All right. You are not pulling off that adhesive cover. All right. Just leave it on like just how it is. You're gonna place it on the exo. It's gonna fall off perfectly fine. All right. We don't have enough chest seals going around, so then everybody can actually place one. So we're gonna have to make do with what we have. So when the candidate places the occlusive dressing onto the injury, they're going to state
on the exhale.
That's all you need to do. All right. Then you're going to log roll the casualty over onto the unaffected side. Keep in mind, you can be on the left side of the casualty, you can be on the right side of the casualty. But you can either pull the casualty towards you, push the casualty away, but you need to make sure that they're rolled on the unaffected side. He uses kind of like the modified rest position to help him out. You don't need to necessarily do that, but it's up to you. You're then going to start searching the back and find the same thing, all right? But it's going to be an exit wound, piece of tape with a little marking on it. You're then going to create a makeshift occlusive dressing with the wrapper. All right, you're gonna repeat the same steps as before, just you're gonna tape all 4 edges down. Somewhere in the mix, you need to tape on the exhale. So most people like to do tape 3 sides on the exhale, tape the 4th side, all right? But as long as you say that somewhere in there on the exhale, perfectly fine. Once again, the pieces of tape are gonna be provided for you on the outside of the CLS bag.
On the exhale.
Just like that, all right? Then you're gonna roll the casualty back over. If you raised up the arm and the leg, then go ahead and lower that shit back down. Now you've reached step number 2, where you're going to verify the presence of a collapsed lung by saying, all right, verbalizing at least 3 indications, all right? So this same thing as before. What was the first one? Tracheal deviation, all right? The grader is going to stay back, does not have tracheal deviation, but has mild jugular distension. Please disregard anything that the grader stay back. It's just a prompt we have to read back. Second one, loose skin. You observe mild cyanosis. Third one, you observe 2 signs of shock. All right, that's the reason why we picked those 3, because you just blasted right through that shit. So now that you have just confirmed that they do in fact have a collapsed lung, you need to begin treating that. You move over to the sandbag. All right, you're going to pull out your little alcohol wipe and your needle D. You're going to find the insertion point on the sandbag by feeling across the ribs. All right, between the 2nd and 3rd rib in the intercostal space in the mid-clavicular line. So anywhere, doesn't have to be on top of the 3rd rib, just anywhere between the 2nd and 3rd in line with the nipple. All right, during actual test week and everything, you're gonna see that there's a hole there because, you know, everybody's been stabbing it the entire time. But notice how he places his finger there, so he does not have to find the insertion site again. All right, he's gonna take out his alcohol wipe. All right, now keep in mind, during practice week, if you so choose, you can tear it open and you can actually sterilize. All right, if you don't want to, perfectly fine, just hand arm signals, whatever. But during test week, you will tear it open and you will sterilize. All right, so he's gonna start cleaning the insertion site from the center, working his way out in a circular motion, approximately 3 to 4 inches, about the same size as the occlusive dressing. All right, notice again how he places his finger there so he does not have to re-find it. He's then going to take out his needle and he's going to insert it into the sandbag 9 degrees to the chest wall with the bevel facing up until you hear a pop and a hiss. All right, obviously it's a sandbag, you're not going to hear the pop and a hiss or it's going to freak me the fuck out. You're then going to remove the needle and discard per unit SOP. Unit SOP is back in the original container with the cap on. That way you don't end up accidentally stabbing yourself or cause further injury to the casualty. Next, you're going to create a triangle with both hands. You're going to place it on the sandbag around the catheter and say
decompressing.
That's all you need to say. You don't need to push down or any of that shit, just say decompressing. All right. Next, you're going to either have a flutter valve provided for you or you're going to create a flutter valve. During test week, you will have one provided for you. But, so everyone's tracking, just to create a flutter valve, all right? It's a latex glove. You're gonna take your little shears, you're gonna cut off the bottom of one finger, you're gonna cut off the tip of that finger, and that middle portion, that is going to be your flutter valve, all right? He has one provided for him, and with another piece of tape that is provided for him on the outside of the CLS bag, he is then going to secure the flutter valve to the catheter, all right? Flutter valve to catheter, not to the chest wall. So, bottom portion of the flutter valve to the orange portion of the catheter. All right. After he has secured the flutter valve to the catheter, we need to know that the flutter valve works. So the candidate is then going to say,
I observed the flutter valve is working.
you can say it works, whatever you so choose, just it works, okay? Then with the final piece of tape, little fancy pants, rib pants, ribbon method, whatever you so choose, you're then going to secure the catheter to the chest wall. You're going to tape down one portion on one side of the catheter, you're going to overlap the catheter, and you're going to cross the tape, all right? A little crisscross applesauce, and then you're going to then secure it to the sandbag. After that, you move back to the casualty to gain its vitals. You're going to take out your second alcohol wipe, all right? You can no longer use the first one because it's no longer sterile. You're then going to disinfect either the index, middle, or ring finger, all right? Doesn't matter which hand you so choose, just we recommend the side that you're already on because it's right there, all right? You're then going to grab your pulse stat and you're going to place it on said sterile finger. Now, on the pulse oxes are going to have the heart rate of the casualty, all right? The heart rate, otherwise known as the pulse, and the O2 stat percentage, all right? That's going to be provided for you. Those numbers aren't even going to change, but it's going to be like that during test week. Right now, we have little finger splints with tape across them just because our pulse oxes have been starting to walk away. So we're going to make do with what we have until actual test week, all right? So after you sterilize that finger, you can place the pulse ox on, and then you move to your final step, filling out the CC3 card. All right, just like reading a book from top to bottom, left to right. Top is going to be the evacuation. You want the casualty to get out of there as fast as possible. So urgent. You're then going to go down to the date. So whatever date today is, whatever date that y'all are coming through for test week, whatever date, just put it down. Just make sure it's in the correct format that is located already on the TC3 card. Next is going to be the time. Now you do not need to watch, however it helps. All right, so you can guess whatever time it is, whatever, or you can just look down. You're going to write down the time, but then you're also going to put down a L or a Lima at the end, signifying that's local time. So for example, 0842 Lima. Underneath that is going to be the mechanism of injury. All right, states and conditions that they received a gunshot wound, so GSW. Underneath that is going to be the picture of the casualty, the front and back picture. All right, you're going to put a little X where the injury is. So it's going to be the upper left for the front and the back. Underneath the picture is going to be another time block, all right? That is going to be the time that the vitals were taken. It can be the same time as prior, it can be a minute after. Really don't care, just as long as there's an L at the end signifying local time. Underneath the time block is going to be the pulse. All right, pulse is going to be provided for you on the pulse ox, on its finger. All right, it's going to be 80 beats per minute, but you don't need to worry about memorizing that. Just write down 80. Next two lines are going to be the blood pressure and the respiratory rate, all right? Skip those, you don't need it. Underneath that is going to be the O2 stat, all right? Once again, it's going to be provided for you on his finger on the pulse ox, all right? So it's going to be either 98 or 99%. Those numbers aren't going to change, they're going to be given to you. Finally, underneath that is going to be the AVPU box, all right? So once again, states and conditions that casualty is alert. So write down either A or write down alert, whichever you so choose. The final box for the front of the TC3 card is going to be the pain scale, all right? You can skip that, but some people like to write a number in there, so a number between 1 and 10 for how much pain the casualty is in. You can write a number in there if you so choose. You can skip it if you so choose. Doesn't matter because it's not a no-go criteria, all right? So you're gonna flip it over. Same thing with the back from top to bottom, left to right. Very top is gonna be the evacuation again. So urgent again, all right? Next, there's gonna be a bunch of words with red lines going through them. If you see a red line going through it, completely skip it. That's just so then you don't end up checking the wrong box. But the next open portion is going to be the Bravo portion for treatment. So what did you do to the casualty? Give him a needle D and a chest seal, all right? Don't worry about what type of chest seal, just put an X on the box. After that, you can skip everything else, nothing in notes whatsoever, and go all the way down to the bottom to the first responders information, all right? So that's going to be your information. So your last name, your first name, and the last 4 of your social, all right? Do not give us the last 4 of your social, just 1, 2, 3, 4, whatever you so choose. Perfectly fine, all right? After that, you're done, all right? That concludes M7. Do I have any questions at this time? All right, so keep in mind,